Hi there, welcome to Anatomy at SI. My name is Jaden Cranial and this is Ashton Walter. We're going to try to help you learn a few things out of your lab manual. Make sure that you pull out your lab manual and follow along with us. We're starting in Lab 2, Section 2 with the cranial bones. For the first one, we've got the frontal bone. Jacob, would you mind zooming in for us? So, on the frontal bone, we've got three structures that we want you to know. We've got the supraorbital margin right here. We've got the supraorbital foramen right there. And then we've got the glabella, which is in the center. Now, Jacob, if you could zoom out for a second, I'm going to help kind of try to make sense of a couple of these words. So, we've got supraorbital margin. What the heck does that mean? If we take that word and we tear it apart, we can see that it actually has a few pieces of it that can help us make sense of other words. So, supra means above, orbit means eye, and al means pertaining to. So this word literally means pertaining to above the eye. And if you look back on our model, the supraorbital margin pertains to above the eye. The supraorbital foramen, we know that the word foramen means hole. If we look right here, we see, if you would zoom in for us again, Jacob, we've got these two small holes right here. Those are the supraorbital foramen, the holes that are pertaining to above the eye. Next, we've got the glabella. If you need help remembering that one, just remember that the glamorous glabella is where your glamour's at. It sits right on your forehead. Next, we've got the temporal bone. For the temporal bone, we're going to turn this model over to the side, and you'll see that this is actually kind of up connected with our skull. And there's some structures on the inside of it that we want to show you too. And for that, I've got this smaller model right here that we'll kind of use to turn things around and look for stuff. So, for the first structure that we want to look for, we've got the mandibular fossa. It's called that because the mandible is what sets inside of it. If you see right there, that's the mandibular fossa. Fossa means flat depression. Mandible is pertaining to this mandible bone, right? It's going to connect right back up in there. If we look on the model that doesn't have the other bones, it's right up in there. Now, next we've got the external acoustic meatus. The external acoustic meatus is going to be this hole right here. It's on the outside of your temporal bone, and it's where the external portion of your ear is. Now, I just used a very important word there. And Jacob, if you could zoom out for us again, we're going to talk about it up here too. So, we've got the word external and the word internal right here. External has the prefix ext. If you've heard of an external, like an exoskeleton on a bug, right? It's a skeleton that's on the outside of its body. We have an endoskeleton. It's inside of us, right? No different. We've got external, meaning on the outside, and internal, meaning on the inside. So, going back to our model right here, zoom in for us one more time. We've got the external acoustic meatus, which is on the outside of the temporal bone, and then on the inside, we've got the internal acoustic meatus. You'll notice that on this model, this hole and this hole do not line up. There's a divider in between there. That's just how the model's built. But it can help you as we get through some of these other structures. Now for the next one. Before we leave the external acoustic meatus, another way to remember that it's your auditory canal, right? Your acoustic meatus, acoustic can also mean guitar, right? Blah, 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 sound, right? Acoustic, something that we listen to. That's where your auditory canal is, or your ear, right? That's where sound passes into your ear. This is the external opening, there's the internal opening. Next, we've got the styloid process. For all of you 3DS players, it looks just like a stylus. Super easy to find on this model. If we take it and look at it with the model that has all the other bones, you can see it's still pretty easy to find up in there, just kind of near that mandibular fossa that we were talking about. I'll use my pen so my big finger's not stuck in the way there. So, next we've got the mastoid process. The mastoid process is kind of this massive looking process that's out next to the external acoustic meatus. It also kind of looks like an asteroid, right? Mastoid, asteroid. It sits right there next to the external acoustic meatus. After the mastoid process, we've got the carotid canal. The carotid canal, if you've heard of the carotid artery before, is where the carotid artery passes through. So, if we take it right here, we look on this model and we see that there's the carotid canal. And if you can look, it goes all the way through. If you're shown this model, you should be able to see all the way through the carotid canal. That's different from the external acoustic meatus and the internal acoustic meatus. You can see through the carotid canal. And for the next two bones, they're paired. These are the two parietal bones, these green bones right here. There's two of them and they're paired together, the paired parietals. They sit on the top of your head. Awesome. So for our next bone, we've got the occipital bone. The occipital bone is going to be this blue bone that's found on the back of our head, on the bottom, right? This blue region right here. Ashton, would you mind holding that for us?
Absolutely.
Sweet. Thank you so much. I've also got it cut out right here, make it a little bit easier to see, but I think we can use this for right now. So we've got a couple different structures that we want you to know on this. First one is super easy. It's the foramen magnum. Foramen magnum, if we remember, the word foramen means hole. Magnum means big. This literally translates to big hole. The foramen magnum is the big hole. The occipital condyles are going to be these two flat regions right here, right? The two occipital condyles, they're on the back of the head and they connect to your spine to help you rotate your head. Next, you've got your hypoglossal canals. The hypoglossal canals, if we take this part right here and we kind of angle it up, you'll see that there's some small canals on the inside and on the outside right there. Those are the hypoglossal canals. If we reorient like this, the brain sits right here and the hypoglossal nerve, which helps us speak, comes through that canal. Hypo means below right here. Gloss means tongue, and AL means pertaining to. Hypoglossal literally means to pertain to the tongue. This is where the tongue nerves pass through, the hypoglossal canal. Next, we've got the external occipital protuberance. The external occipital protuberance, we know that since it's external, it's on the outside. And since it's on the occipital bone, we know the occipital protuberance is going to be this guy right here. A protuberance is a bony prominence on the outside of the bone. For the external occipital crest, it's going to be this region right here that crests upward from the protuberance. Next, we've got the superior nuchal lines. Now the superior nuchal lines, from the way I'm holding this model, are going to be right here. Here's the superior nuchal lines. Now they're called the superior nuchal lines because if we had our whole model back up here, we take it like this. Here's the superior nuchal lines, and if we pull it up like this, we see that the superior nuchal lines are above the inferior nuchal lines. Superior nuchal lines, inferior nuchal lines. Flipping it upside down, superior nuchal lines, inferior nuchal lines. Next, I want to take us back up to the whiteboard here. We've got a drawing that should hopefully kind of line up some of these pictures. So, if we looked at the back of the occipital bone, we see that there's the foramen magnum, the occipital crest, and then the two sets of nuchal lines and the hypoglossal canals. Now, if you can draw this out and pretend like it looks like Mickey Mouse, it makes it a lot easier to remember. You've got your two ears, which are the hypoglossal, those are going to be the occipital condyles. Occipital condyles are the ears of Mickey. We've got the foramen magnum, which is going to be Mickey's head. We've got the occipital crest, which crests upward from the protuberance. Mickey's body is the crest. The occipital protuberance is down here, and I think you can guess what that is on our drawing. Next, we've got the superior nuchal lines, which are down here again. Here's your superior nuchal lines. Those are the legs of Mickey. Next, we've got the arms of Mickey. That's these right here. Those are going to be your inferior nuchal lines. Those should map out pretty well with what you've got right here. The hypoglossal canals are going to be his little ear canals, right? They map out right underneath that bone, just like they would be his little ear canals. So if you can remember the anatomy of Mickey, you can hopefully remember the anatomy of your occipital bone as well. Okay, so now we're going to move on to section 3. In section 3, we're going to talk about the sphenoid bone. The sphenoid bone is this bone right here. If you look within the skull, you'll see that it's kind of located within everything, and it's hard to see on this model when we've got all the other bones there. So we're going to use this one since it's all kind of separated out. So, first of all, do you remember what the prefix teri means?
I believe it means wing,
Yes.
correct?
Yes, it does. So teri means wing, and goid means pertaining to. So the pterygoid process is going to be the processes that look like wings, right? Winged processes, pterygoid process. That's going to be these right here. Kind of looks like the wings, right? Wings. Wings. Next, we've got the sella turcica. The sella turcica is going to be on the back of this. So if we flip it around, bam, we're going to see the sella turcica is this structure right here. Sella turcica is Latin for Turkish saddle, and it's the saddle where the pituitary gland is going to sit because the pituitary gland wants to be a cowboy. Next, we've got the optic canal. The optic canal is going to be directly behind that saddle that we just talked about, the sella turcica. These two optic canals right there, right, just behind the sella turcica, that's where our optic nerves are going to channel through, right? Next, we've got the optic groove. The optic groove is this little tiny groove that connects the two optic canals. It's actually where a part of the optic nerve is going to split and cross over, and so they can connect and transmit information back and forth. But that's for a later unit. Next, we're going to talk about the superior orbital fissure, right? So the superior orbital fissure is a little bit easier to see if we use this model because it actually, well, yeah, we use a couple different models here. These are a little bit difficult to see because they're formed by the sphenoid bone and other bones that are connected to it, right? So if we've got the superior orbital fissure, do you remember what orbit means?
Eye.
Yes, orbit means eye. So if we've got the superior orbital fissure, where is this going to be? Probably
Above the eye.
Probably somewhere above the eye, right? It's great to know your prefixes and roots in this case. So superior orbital fissure on the sphenoid bone is going to be up inside there, and it's the top border between the frontal bone and the sphenoid bone. Can you see it up in there? Kind of hard to see. It would be this right here, this border, connected to the frontal bone. So it's between the sphenoid bone and the frontal bone. Next, we've got the inferior orbital fissure. So again, we know orbit means eye, so this is going to be pertaining to the eye. And since it's inferior, we know that it's below. Superior is above, inferior is below. So for the inferior orbital fissure, we've got the connecting region between the sphenoid bone and the maxilla bone. That's going to be this line right here, between the red and the purple bones. That is going to be the inferior orbital fissure. We've got 3 more structures on the sphenoid bone that you need to know, and these ones are pretty easy to remember. So first, we've got the foramen rotundum. The foramen rotundum are going to be these 2 holes right there. Bam, bam. Those are your foramen rotundum. They're round. Rotundum, right? If we take a look back over here, well, I missed a few of our terms, but we can see that we've got foramen rotundum right here, right? Rotundum, right? Rotund, meaning round, right? If something is rotund, it's round. So we can look back at our model. We see that these 2 holes are in fact round. Next, we've got the foramen ovale. The foramen ovale are going to be directly below the foramen rotundum. The ovale are actually oval shaped. Pretty easy for you to recognize compared to the other ones, right? And lastly, we have the foramen spinosum, which is right here. Foramen rotundum, foramen ovale, and foramen spinosum. If you need help remembering that, just remember that ROS, Ross, is your friend. Rotundum, ovale, spinosum, Ross. And that's on the back of the sphenoid. So if we flip it back over, this is the frontal view of the sphenoid. All right, next we're gonna move on to the ethmoid bone. So for the ethmoid bone, it's going to be found all the way up inside of our head. You can kind of see that yellow bone way up in there, right? It's kind of hard to see when you have the other bones with it, so just like the other ones, we've removed it for you. We've got a couple different things that you need to know about the ethmoid bone. First is the crista galli. The crista galli is going to be this prominent point right here, right? It's this prominent rooster-looking point or rhino-looking horn that you can see right at the top of the ethmoid bone, and it helps you orient yourself when you're looking at it. See, if you're holding the ethmoid bone, you should see a rhino horn somewhere on the top. Next, we've got the cribriform plate. The cribriform plate is directly behind that crest that we talked about, right? The crista galli, cribriform plate. The cribriform plate is actually where the olfactory bulb is going to be housed. It's a bundle of nerves that helps us smell. We'll learn about it later, don't worry. But next, we've got the perpendicular plate. We've got that crista galli up here, cribriform plate back here, and the perpendicular plate down below. It's perpendicular to the cribriform plate. You can kind of see back up here, we've got the crista galli, the cribriform plate, and that perpendicular plate, which is perpendicular to the cribriform. Alrighty, if we flip this over onto its side, we've got a couple other structures that we need to learn. Superior nasal conchae are going to be this structure right here, bam, and on the other side, bam. Next, we've got the middle nasal conchae, which is directly below it. You got your superior and your middle nasal conchae. So those are all of the structures that we need to know on the ethmoid bone. And next, we're going to talk about the different sutures that help connect all of the bones of your skull. The first is the coronal suture, and these map on pretty well with some of the other, with some of the body planes that we've learned from, like prior in Lab 1. So this first one, coronal, where do we think it maps onto? Do you remember where the coronal plane is?
I believe it is this one right here.
Right. That one right there. That's the coronal plane. Maps out just like that, right? Coronal is going to be this plane right here, whereas we've got squamous. If we took the skull and we squished it together, we'd have our squamous suture right there on the side. Squamous suture. If we turn the skull onto the back, we see that here is the lambdoid suture. And then following the sagittal plane, we've got the sagittal suture right here. The coronal suture has to do with the frontal and parietal bones. The squamous suture has to do with the parietal bones and temporal bones. And the lambdoid has to do with the parietal and the occipital bones. The sagittal splits the two parietal bones. Awesome. So for our last section, on section 4, we've got the last of our facial bones. For the first bone in this section, we've got the mandible. The mandible forms our lower jaw, right? There's the mandible. So we've separated the mandible right here. That way we can see some of the individual pieces of it. And as you can see, there's a couple of them that we need to know. The first one is the mandibular ramus. The mandibular ramus exists between this point and this point here. Ramus means branching off of the main structure. And if you see the main structure that has our teeth right here, it branches upward, forming the ramus of our mandible. That's the ramus of the mandible. Next, we've got our coronoid process. The coronoid process helps to form this C shape up here. It's at the anterior portion of our mandible, right? We've got this coronoid process. If we follow the C down inside, we've got the mandibular notch. The mandibular notch exists between the coronoid process and the head of the mandible. The head of the mandible is extremely important, and we've talked about another structure that is paired with before. The head of the mandible is going to connect up into the mandibular fossa within the temporal bone. There it is. Okay. So the head of the mandible connects to that mandibular fossa. And that's what helps to form the bone, I can't speak. That helps to form the joint of our jaw. So next we've got the mandibular foramen. The mandibular foramen are found inside of the mandible. So if we flip them or flip the whole bone from the back, we can see this foramen right there, and that foramen right there, and that foramen right there. Those are going to be our two mandibular foramen, which are on the inside of our mandible. Next, we've got the mental foramen. So we know that foramen means whole, right? And mental, if you look back at your terms from the beginning, means chin. Mental means chin. So if we're looking for the mental foramen, we look at our chin and we see we've got this hole right here and that hole right there, right? Two holes. Those are our mental foramen. Next, we've got the mental protuberance. So we know mental means chin. That's the first place we're going to look. We've got the mental protuberance, which is this bony prominence at the end of our chin. It forms the butt of our chin. right there. Alrighty. Next, we've got the
I believe maxilla.
yes, maxilla.
Maxilla.
Awesome. So we're switching bones. We're done with the lower jaw. We've already covered all of that. Now we're going to switch to the upper jaw. That's this purple bone right here. It's the maxilla. And there's actually two of them. You'll notice that there's a little dividing line right there. That's because the maxilla is a set of paired bones. There are two of them. Let's go ahead and take out our individualized maxilla right here. That way we can kind of find some of the structures on it. So the first one that you need to know is alveoli. Alveoli is the space that our teeth is actually going to sit inside, right? So we can't pull the teeth off this model, but it's the space that the teeth are sitting inside. It's like that little region that this tooth is just going to clock right into, right? You can see it drawn out, the space in blue, that's going to be your alveoli. Alveoli means deep pit, and you'll actually see that term come up a couple different times throughout anatomy, especially within our respiratory system section. Awesome. Next, we've got the alveolar process. So we know alveoli means that socket that the teeth are gonna sit in, and we see that the alveoli process is gonna be this ridged region that's just above that, right?
Now, is there another place where the alveolar process is?
Yes, the alveolar process is not just on the maxilla, which is on the upper jaw. The alveolar process is also on the lower jaw, right? Because we've got that same bumpy ridge where those alveoli exist. We've got teeth on the top of our jaw and teeth on the bottom. So it makes sense that we have alveoli on the top and the alveolar ridge on the top and both structures on the bottom as well. So both the maxilla and the mandible have those alveoli and the alveolar processes. Next, we've got the inferior orbital fissure. So we know that inferior means below, orbit means eye. So if we have this guy right here, we see that just below the eye, this is the bottom of the eye, we have the inferior orbital fissure right there.
What does fissure mean again, exactly?
Fissure is going to be a place where two bones connect. And in this case, we've got the sphenoid bone, which if we take another view right here, is that red bone in the very back. And we've also got the maxilla, which is this purple bone. And that, let me make sure I'm saying it right, inferior orbital fissure is in the back on the lower region.
Awesome. So the two bones connect then?
Yes.
Perfect.
Two bones connect on that fissure. Sweet. Next, we've got the infraorbital foramen. So, infra is going to mean below. We know what eye means, right? Or we know what orbit means. It means eye, right? Infraorbital foramen. So it's going to be the foramen that exists below the eye. Bam, bam. Pretty easy to see on this model.
Now, I believe there's only one of those, correct?
Of the infraorbital foramen?
Yes.
Well, there's two of them because we've got two of the maxilla paired bones, right? We've got the one right here and the one right here.
All right.
And next we have a page flip. So go ahead and engage in that with me. And we're going to start in with our last section of section 4 of the facial bones. These are just the remainder of our facial bones. Most of these are pretty small, but we do need to know them. A lot of these are also kind of connected to some of the other bones in our model. So I'll try to help you. I'll try to say which color they are to help maybe pair them with which structure is named the right thing. God, I can't speak. It's too bad nobody writes a script for these videos, you know? All right, so zygomatic bones. Zygomatic actually means, it has a prefix, right? We were talking about that those prefixes and suffixes that we need to know. And zygo is a prefix that means egg, right? And so if you look at this yellow bone right here, kind of looks like a cracked egg, right? If we cracked an egg and its yolk was just all over there, right? That zygomatic bone is our cracked egg, AKA our cheekbone, right? One right there, one right there. And there are two of them, they are paired. We've got one on one side, one on the other, right? That's the zygomatic bone, aka zygo meaning egg. If you need another way to help remember that prefix, if you remember the zygote from biology, right? Zygo meaning egg. Next, we've got the lacrimal bones. Anytime you see the word lacrimal, I want you to think tears, because you're not going to remember lacrimal and it's going to make you cry. So remember lacrimal being your tears, because it's where your tear ducts are found, right? So we've got the lacrimal bones, which are those orange bones that are up inside, right? Just above the maxilla. They're paired, there's 2 of them. Those are our lacrimal bones, and they help with our tear duct system. They actually drain tears down into our sinuses. We will learn all about that later. It's super cool. All right. Next one is one of my favorite bones in this whole model. We've got the vomer. The vomer is going to be, let's do this one first. If we take this model right here, we can see that there's like this orange bone up inside there, right? See that? See me moving it there? If I were to pull that out, it looks like this. Yes, it looks like a Dorito. The vomer is the Dorito of the nose. It sits just inside there, right there, and it helps to form our nasal septum.
Another way I like to remember it, if you're a Harry Potter fan, Voldemort is pretty flat-faced, so you know that he is missing his vomer.
Yeah, Voldemort, he lost his vomer a long time ago. Voldy-vomer. All right, let's go. We've got our palatine bones. We've all heard the word palate before, right? Palate's going to be, it helps to form that region at the top of our mouth, right? Our palate. So if we take the maxilla, here's our disconnected maxilla from everything, we can see these red bones on the bottom that form our hard palate. And those are the palatine bones, right? Palatine bones. Next, we've got the nasal bones. Now, if you've heard the word nasal before, right? Like nasal spray or something like that, nasal just means nose. So our nasal bones are going to be these 2 white bones right here. Those 2 white bones. They help to form the roof of our nose. Next, we've got, and last, we've got the inferior nasal conchae. So we learned about the superior nasal conchae and the middle nasal conchae. Remember what bone those were on?
I believe those were on the, gotta look back here, the ethmoid, right?
They were on the ethmoid bone. Absolutely, yes, they were. But notice that the inferior nasal conchae are not on the ethmoid bone. So the ethmoid bone, right here, remember this yellow bone? It's going to have our superior and our middle nasal conchae. But if you want to find your inferior ones, you have to pull out the maxilla, and you'll see them up inside right there. That yellow structure connected to the maxilla. The inferior nasal conchae don't come off of the maxilla, so we use the maxilla during lab to help point that structure out as well. But it's the yellow structure found up inside on the maxilla. There's a couple different angles. Hopefully you can see that. Yellow structure up in there.
So is this a paired bone or a single bone?
That one's also a paired bone. And importantly, all of these bones except for the vomer are paired bones, right? All of these bones exist in pairs of 2. Those lacrimal bones, right? The nasal bones are 2, but then the vomer, there's only one of them. Only one vomer in the nose. So that concludes lab 2 and all of the sections of it. Hopefully you do well in lab, and good luck on your quiz this week.